All right, in the next couple of weeks coming up, specifically on Thursday, February 23rd at 1 p.m.
Central Time.
Central Time, we are going to be doing a webinar on search engine optimization formula. It's our SEO formula. We're going to be helping patient care businesses rank on Google.
Yeah, we're sending out emails, but at the same time, if you are slightly interested, hit us up at hello@patientcaremarketingpros.com and we'll send you the link to it. It's going to be about an hour, hour and a half. And we're going to go through the whole process. Like the last webinar we did last month was actually super successful. We were very happy with that. Had a good turnout, had some good information, had some good follow-up with some people, which was great.
More importantly, we were able to help some people.
Yeah, there was actually some questions thrown out there, and the answers they gave back were like, oh, we can help you.
That's right.
And the goal is that we give you stuff to do after the webinar. It's not just turn this on and listen and say, well, that was fun. No, this is like a worksheet, some things that will actually, like, if you do this will actually help you.
This will be a practical application masterclass on search engine optimization for patient care businesses. Mm-hmm. Click the link in the podcast notes below to register. And again, it's on Thursday, February 23rd
at 1 p.m. at Central Time.
We will see you there. Hey, welcome back to another episode of Walk-Ins Welcome. We are excited to help you triple your revenue through digital marketing services and exceptional patient experience. Michael Ray is with me. Dr. Ropp is with me. I'm Nick Horde. And here's the cool thing, Michael, is we're getting back to our series where we're interviewing professionals in the medical space. I'm excited to have that.
So great. And honestly, this is a perfect start to the year as well in terms of interviews, because we've known Dr. Ropp for a little while,
right?
And so we've developed that relationship over time. But tell us a little bit about Dr. Ropp.
Let me do this quick intro, and then I'll let you say hello to everybody. So Dr. Ropp is the co-founder and medical director of Aspen Medical Center. It's in Santa Fe, New Mexico, and they also have another location in Espanola. He's a board-certified family physician, and they offer primary and urgent care. Dr. Ropp enjoys international volunteering, which I think is super cool. Soccer, backpacking, and of course, time with friends and family. Hey, thank you for joining with us.
Yeah.
Thank you. Yeah, it's great to be here. Thanks for having me.
And we're just going to roll right into the first opening question and just to kind of get the episode going. What's one thing about owning an urgent care business that surprised you the most?
That's a good question. What surprised me the most? I guess hard to answer that in very simply, but I think there's just so much involved. There's so much behind the scenes. I mean, there's a lot of responsibility. There's a lot of moving pieces. I think I've recently been looking at all the contracts that we have with different vendors and different relationships we have, everything from the people who clean our floors to the people we do marketing with, the people that do our electronic health record. I think we have at least 60 different vendors relationships we have. So it's there's just so much behind the scenes that you don't realize it until you're the one that's paying all the bills for all those vendors. It takes a lot to just operate, keep the operations going.
60 vendors. So
that's the definition of spinning plates.
If
I were ever going to say.
And it's one of those things you assume. Okay, we signed off on this whenever ago. I'm sure things are fine. And then you look at the bill and like, I don't remember paying that much before.
Right. I guess, how many years have you been in business now, Dr. Ropp?
So we opened up almost 10 years ago. So we're approaching the 10-year mark. Of course, we had to start the organization and start to get insurance contracts and everything before we opened it. So we started this journey over 10 years ago.
Oh man. And you didn't start with 60 vendors.
No.
How did that unfold? I mean, you obviously there's the core ones. I got to pay my electric bill. I've got to pay my taxes. Right. I've got to hire people. But what are the ones that you're like, oh, I did not see that coming?
Well, for one, we have a company that we work with to work on all of our insurance contracts and credentialing with insurance companies. And, that's a huge process that usually takes several months to become credentialed and contracted. And we could have tried to do it on our own, but we found it easier to go with a company. we do our own in-house billing, but we could have gone with a billing company, but we do use billing software that connects with our electronic health record. And so there's just a lot of different moving pieces. We have someone come in to do our floors because we have polished concrete floors, which are pretty low maintenance, but they get scuffed up and we have to have somebody, so there's just all different things like that.
Well, and I'm curious too. So, did the vendor list get longer when you added the second location, or did it stay the same vendors?
It probably got a little bit longer because we've got different people doing the cleaning up there. We've got a different internet service provider. So it did get a little bit longer. I mean, whenever we could use the same vendors, we did, but we couldn't always do that.
Yeah.
Well, I want to hear about Aspen Medical Center. Tell me about where you are today in business and kind of the vision that you had for the company.
So when we first started, 10 years ago now, we felt that there was a need for more urgent care in Santa Fe and in northern New Mexico. And we also like the idea of integrating the primary care with the urgent care, making it sort of a one-stop shop for patients. And so, we had this vision of a place where people could come and see their regular doctor and do their checkups, but also, if something happened after hours or on the weekend and they suddenly came down with a sore throat, or they thought they might be getting COVID and they wanted to check in with someone, maybe get a prescription or see if they needed to be further evaluated, there's a place for them to go where we have all their medical records. They can come and see us. And so that was sort of our vision. Now we have in-house labs, in-house x-rays at both facilities. We do acupuncture next door, so we sort of blended the East and Western philosophies of medicine. And we've got another location in Espanola that was an add-on after we had started in Santa Fe, and we're the only other urgent care place in Espanola outside of the hospital, which doesn't even do that much urgent care anymore. It's more of an ER. And so the thing that's changed is in Santa Fe, when we started, we were one of about 3 different urgent care options, and now they're somewhere between 7 and 10 options, depending on if you count, the 2 CVS Minute clinics and other places that are available like that.
I would be interested to know. It's been my experience that my primary care physician is kind of a 3-month out, untouchable person that I can't get in front of without this long, drawn out process. And then there's the immediate urgent care space where it's a walk-in welcome, right? Or you can save your spot online, like Clockwise, I believe is what you guys use. How do you bridge that gap from somebody, and really, I'm trying to phrase this question right, not just bridge the gap, but like, what is the difference in how you would treat somebody for primary care versus immediate care?
Well, of course, with immediate care, there's some urgent issue that the patient has that they feel needs to be addressed right away. And so that's something we want to get people in a timely manner. We want to make sure that we address their major concern or concerns. With primary care, it's almost like sometimes I think of it as a mixing of agendas. So, someone may come in for their primary care visit and they may have, personal issues that they want to discuss or their own concerns, medical problems. But my goal as a primary care provider is to keep someone as healthy as I can for, help to improve their health and quality of life and help them, live as long and healthy a life as possible. So I may, bring in a discussion of other things like, oh, we really should get your blood pressure under control. It's been high the last couple of visits, and I want to talk to you about how to do that. But they may not feel anything from that, but they may want to talk to me about, the headaches that they're having, or their back pain, or their acid reflux, or whatever it is. But just to get back to your point, what you described, 3 months to get in for the primary care provider, is a very common problem. I mean, and certainly in New Mexico, there's a shortage of all kinds of physicians, including primary care providers. But at Aspen, what we try to do is, well, number one, they can always come in as a walk-in and see at least one of our other providers. But I also try to keep a couple of slots open, almost every day or every week anyway.
That's good.
So that if someone calls in at the last minute, they need to be seen. Very often, I can squeeze them in either that afternoon or in the next day or so.
I'm just trying to think, like, if more doctors, just in general, I get the idea of filling up your calendar. It's revenue, it's keeping your day full, but I just wonder, Michael, like, if more medical professionals would just keep some open availability for those who genuinely need to pop in there.
Some buffer,
I like that. I like that a lot. I think that's actually that might be a unique separator for you that I've just never explored before. That's kind of a big deal.
Mm-hmm.
Yeah. We try, like I say, we try to be a one-stop shop, and we try to really accommodate people and meet patients where they're at, and whatever they're ready for.
Well, we've had the unique opportunity to read your reviews, and you guys have a great reputation of taking care of your patients and having that one-stop shop approach. I think that's fantastic. So, Michael, I know you got some questions. I'll keep going if you want.
Well, I was going to say, so you said you started this 10 years ago. What was like, I'm going to start my own urgent care. I'm just going to go out there and do it. Like, what was the driving force behind that?
Let's go.
Because that's a big, let's do this.
Yes. And, I have to be honest, if I knew what I was getting in, if I knew then what I know now what I was getting into, I don't know if I would have done it all over again. But
Honesty.
I wonder how many people are listening right now. They're like, I feel that.
Like,
but I will say that, everything that's happened, opening up Espanola and whatnot, it wasn't scripted. It wasn't planned. I'm basically the type of person that takes advantage of opportunities as they arise. And so, through a twist of circumstances, and different things that happened and that were happening, over 10 years ago now, led to me having this opportunity to open this practice. And, I have to mention Joanna Anaya at this point. I have to give a shout out to her. She's, our operations, maybe the brains behind the business. She really helped me open up Aspen and create this, this service to the community is the way I like to think of it. And, without her, I wouldn't have been able to done it, to have done it. And, the way that our arrangement was, from the beginning, was sort of, Dr. Ropp, you see the patients and I'll run the business, and there's definitely, been some overlap in terms of our roles and things like that. But you have to be able to do something like this, you have to have the right people, and she was the right person. So,
I mean, I think that's just a testament right there where don't do it alone.
That's right.
Don't just say, I got this. You need some key people to do what they're good at and let the doctor doc, right?
Yeah, doctor's got a doc. Right? Well, we've had a chance to meet Miss Joanna, and she is fantastic.
Yeah, she's awesome. We like
she's
her.
Awesome.
Yeah.
All right. Well, let me switch gears just a little bit. We'll quit talking about all the past stuff and how you got here. Let's talk about the future. So 10 years ago, you started. Well, a lot's happened in 10 years, especially in the past 3 years, right?
Yes.
So it changed perspective on everything. Urgent cares have become, I don't know, instrumental, in my opinion, in the medical community. So I was going to ask, what do you, in your own words, describe as retail healthcare? How do you think about that?
Well, I guess retail healthcare, the way you phrase it, to me, it's a more modern version of healthcare. It's the reality that we live in. Healthcare, essentially, in the world of retail, is treated as another service or another commodity. It's another thing that is provided by different providers. It's provided in different settings. I think in the old days, people used to think of healthcare as, well, it's something that's the doctor's office might be near the hospital because they need to be near the hospital because their patients might be in there. But in retail healthcare, our clinic is in a strip mall, and I think it's bringing healthcare to the people, bringing it to their neighborhoods where they are, and taking it away from sort of the hospital or the ivory tower. And we're trying to, the other thing in retail is there's a lot of competition. So, we've got the CVS Minute clinics, we've got other urgent cares, we've got the hospitals now that are opening up urgent cares. So there's a lot more competition. So there's a lot more, concern of even through, the directives through the CMS, the Centers for Medicare and Medicaid Services, through the federal government. There's a lot of sort of soliciting of patient feedback, and our quality scores, at the federal level, some of that is based on patient surveys. And so, it's just sort of a new era where we're really treating, in some ways, patients as customers, and all that goes into to marketing and providing that service.
I love the fact that you just said patients as customers, because the traditional way of doing things is a patient is a patient, right?
Right.
You're not looking to extract value out of it. And your goal is still to serve.
Right.
You still want to make sure that you're taking amazing care of your patient, but you're also kind of dependent on their return visits, their family visits. It's shifted from just, hey, I'm here, use me if you need me, to now I'm pursuing you as a medical professional. And this is my opinion. Okay. I'm not beating up any doctors or anything like that. I don't want it to come across that way, but it's my opinion that I get better care from retail healthcare than I do from my traditional healthcare. And the reason is because you care that I'm there and they don't.
Well, I was thinking about, you had said the ivory tower.
Yeah.
And so it's like that mind shift of, you're not the only doc in the city.
Right.
Like, I can go somewhere else quickly. I don't have to pay your rate or whatever. I can go find somebody else that give just as good or better care. And I feel like they want me to be there. I'm not just a nuisance to them in their day.
Right.
So, but yeah, I think that's that retail part of it, where, like, generally speaking, when there's competition, things are better for the end user, the customer, or the patient, generally speaking.
It's tougher on your industry.
Yep.
Like, from how do you stand out? How do you break through the noise? But man, if you just treat somebody right, they're going to keep coming back. We have an urgent care here in Birmingham that I'm not going to mention who they are, but it's the only one I'll go to because they made me feel like I was welcome, cared for. The doctor texted me.
Wow.
2 days later to check on me. Who does that?
Yeah.
You know what I mean? It was just next level service. And I'm like, I'm not going to go to another facility. Let's keep going. I got a couple more questions here. So thank you. What a great concept on the retail healthcare. Where do you see the industry as a whole going in the next 3 to 5 years? And then I'll let you take the last question.
Well, I think there are different movements out there right now, and I don't know which direction things are going to go. I mean, I think, you mentioned this concept of retail healthcare, and I think in a fee-for-service environment, which is what urgent care is, we're may in some ways just see more of the same, more competition, more investment. We may see more consolidation of urgent care centers, that type of thing. But there's another movement that's going on right now that is what we call value-based care.
Value-based care. Okay.
Yes, and that's really not, it's different from, almost opposite of, a fee-for-service model. And it's something that's been tried in various forms in the past, but it's being pushed now by the federal government through Medicare, through different programs that are value-based programs. One of which is Medicare Advantage, that a lot of private insurance companies are taking advantage of. And then there's also ACOs, accountable care organizations, which we're a member of with the Christus St. Vincent facility. And this is a way where, you're reimbursed for providing quality care to a population of patients. And there's this concept of what's called shared savings.
Mm.
Uh, and so that what happens through, for example, our accountable care organization is that Medicare looks at all the population, all the patients that are being cared for in this group of patients, and looks historically at how much it costs to care for these patients over the last 3 years. And then if we, let's just, throw out some round figures, let's say it cost, $50 million traditionally to take care of this population. And then this past year, 2022, it only cost us, $45 million. Well, then Medicare says, oh, you saved the federal government money. So we're going to take, a percentage of that savings, let's say 40% after administrative costs, and we're going to give it back to you. So it provides an incentive
Oh wow, that's
It's
to
kind of
provide,
amazing.
yeah, that provides an incentive to provide high quality care at a lower cost. So, I think in theory, the concept of it is a good one. Now, sometimes the way it gets implemented is not ideal, and that's maybe a discussion for another time. But this is another area that could potentially expand and go not only from Medicare, but go into, private insurances or Medicaid populations as well. And it has in the past in various forms, like with HMOs and the whole Kaiser, system, which is in California and other parts of the country. So I see different directions that healthcare could go depending on which segment of healthcare you're looking at.
I could see though discussing the value based care and urgent care style business would probably be like the forefront of that. Providing like a lower, hey, you saved the government money because
Right.
you were efficient, because you were already efficient. You just knew how to be better at it.
Well, we
Exactly.
had on a previous podcast where that person's software would go in and help them
Yeah.
save money at the hospital level.
Yep.
And this sounds like the government trying to step in and say, hey, healthcare is being overrun with maybe inundated. I didn't have to do all 37 of those procedures. I could have done 3 of them to get the job done, but you're just
Right.
trying to bill medical. And we're going to reward you for doing the right thing, is what it sounds like in theory.
Yeah. In
And,
theory.
and I know you also said like in practice it's a little different, but in theory, I like that as a consumer,
Right.
right?
Well, I even think about COVID did a lot of things to the medical world for sure. And but one like personal example, my wife had a procedure done. She had the procedure done 5 years ago, and it was like, your recovery time is 8 hours, and you can leave the hospital. We had to do the procedure this year. This is post major COVID, and they said, oh, because of COVID, we figured some stuff out. Your recovery time is only 3 hours.
Yeah.
And so it went from a full hospital day to half hospital day
Nice.
because they could do it.
Well,
So
they probably needed that bed too.
yeah, right.
Yeah.
So it's amazing how innovation sometimes just comes, crisis innovation
Yeah,
type
crisis
thing.
innovation.
But anyway, but no, that's
They do it in war all the time.
Yeah,
Let's do it
exactly.
in medical too. I mean, that's just another way to do it, right?
exactly. But that's really fascinating. I'm actually,
I've not heard of this. This is great.
yeah, I'm
'Cause
gonna.
typically I'm in the up and up on what's going on in your world, but I haven't heard this.
I love it.
Yeah.
Yeah, this is good.
Hey, well, let me ask you a question then. Since I
Sure.
haven't heard of it, maybe there's a whole bunch of people that haven't heard of it. How do you tap into that resource?
Well, you might want to start at one of the federal government websites, CMS, or just Google accountable care organization, ACOs, or value-based care, and just start, looking at this. And, it's again, it's not a perfect system. And, it's one of those systems where you need to be, as a healthcare provider, you need to be assigned these patients before they really need care to be reimbursed this way. So it accounts for people that are under your care, whether they see you in a visit or not. So that's why, it doesn't surprise me that if you're more involved in urgent care, you might not have heard about this, because it's not, the reimbursement model doesn't work so well in urgent care unless you're assigned all these patients before they ever come in your building, which is not always easy to do.
Well, we've had the opportunity to work with lots and lots of urgent cares, and almost, not all, but almost all of them have a primary care function built into theirs.
Oh,
You're the only one that I've been able to hear that could give me a good bridge the gap on how that works for you, which I appreciate that. Thank you.
sure.
Let me ask you a total. Well, actually, you asked that, and I'll ask the last one. Go ahead.
Yeah. So you've been doing this for 10 plus years now. What's one thing you wish you had done when you first opened your clinic? You know, learning from your lessons, right?
Oh, that's a good question. I mean, I could probably create a list for you if you wanted. But I mean, I guess, for one thing, just to kind of tap into, sort of the online marketing, I might have changed the name of my website and put urgent care
Yeah.
in the title of the website, just because, again, you guys understand a lot more how SEO and all that works, but I think there are things like that, simple things that I could have done that if I would have known might have helped us, a little more over the last 10 years. So yeah, I'm sure there are other things, but that's one, simple thing that I think I could have done differently.
I tell you, we make this joke like the next business that we start, we just put near me as the end of it. Just call it urgent care near me,
Yep.
and you'll probably win. So it's real.
Do it. It's funny. We just helped urgent care launch close by here in Chelsea, Alabama.
Yep.
And it's funny because there's a Chelsea urgent care. Now that's a little city, by the way. It's not this massive.
I think they have like 15,000.
Yeah,
something like that.
Yeah, but it was Chelsea urgent care, and our client's like, "What are we supposed to do about that?" I'm like, we're gonna get you to show up, but anytime somebody searches Chelsea urgent care, you're just not gonna get rid of them. There's nothing we can do about that.
Yeah, it's pretty funny. He's like, "Can we get rid of this?" I'm like, "Yes, we've done it in the past with others. It just takes a little time." And like within they've been with us now for about a month and a half, and we finally just got above the Chelsea urgent care on some searches, so we're working on it. But anyway, yeah, like the naming, like we even joke with the car insurance people of the world. It's not auto insurance; it's car insurance. That's how people search.
Well, just like you don't put immediate care, you put urgent care.
Yeah.
Now you can call it immediate care, and the reason you don't put urgent is because you don't want emergency room.
Yeah.
Right. And I get why they are trying to transition with that, but nobody searches. They search urgent care.
Yeah.
That's how it's going to happen.
You got to stick with the masses.
That's right. And just, push everybody that is, their arm fell off. You just got to send them where they need to go and love on them. But all right. So we have a lot of listeners that have established urgent cares. They're growing to multiple locations. All right. You have grown to an additional location. What would you say is the first step toward taking my single location urgent care and expanding to another location? What is a pitfall that we could watch out for?
I'm not exactly sure how to answer that question. Okay. I mean, I think several things help. I mean, if you've been successful at one location, you got to, by and large, for the most part, you got to stick with your formula, right? Unless it's completely different community in some way. And then I think the other thing is to do your research about that community and see if there is a difference, or if there is a different population that you're going to market to. But I sort of have over the years become a believer in, sticking to your bread and butter. If you do, like we do primary care and urgent care, we've delved into other things. We've tried to do some occupational health, and we had a dermoscopy clinic where we were doing some screening for skin cancers, a little bit of dermatology. We've done different things, but if you just really focus on what you're good at or what you do, which for us is primary care and urgent care, and you become really good at that and be able to do it over and over again, and you can replicate that in another location.
Yeah, it's that classic rinse and repeat model. Do what you're good at and repeat it, and keep repeating it and keep repeating it. We like that model here when we can do it.
Do, yeah.
Like with no reason to reinvent the wheel just because you can.
Right.
But anyway, so Dr. Ropp, we're up on our time here. Thank you again for coming on, spending a little time with us. I know you're super busy, so we greatly appreciate that. Is there anything else you'd like to tell our audience before we leave today?
I don't think so. But thank you so much for having me. It's been great to be here.
Absolutely.
Hey, loved having you on. We hope to have you back on in the future, especially to talk about those kind of loopholes you were talking about. Like maybe we can explore that on our next one. Dr. Ropp, thanks for being with us, man. We're going to see you on the next episode very soon, okay?
Thank you. Take
All
care.
right. Thank
See
you.
ya.
Bye.
Bye bye.